Americans often don't recognize the importance of sleep. NSC is a leader in working to change the culture with research, education and outreach programs related to sleep health in the workplace. Fatigue at work, on the road can be deadly. Daylight saving time begins every year on the second Sunday in March, which in 2019 was March 10th. We lose an hour when the clocks are set forward, except in Hawaii and most of Arizona, and for many that means a tired couple of days as our bodies adjust. People often make light of how little sleep they get on a regular basis. An overworked, overtired condition has become the norm for many. But a good night's sleep is not just a novelty, it's a necessity. The effects of fatigue are far-reaching and can have an adverse impact on all areas of our lives. Work often requires us to override those natural sleep patterns. More than 43% of workers are sleep-deprived, and those most at risk work the night shift, long shifts or irregular shifts. Following are a few facts for employers. Safety performance decreases as employees become tired. 62% of night shift workers complain about sleep loss. Fatigued worker productivity costs employers $1,200 to $3,100 per employee annually. Employees on rotating shifts are particularly vulnerable because they cannot adapt their body clocks to an alternative sleep pattern. Drowsy driving is impaired driving, but while we wouldn't allow a friend to drive drunk, we rarely take the keys away from our tired friends or insist they take a nap before heading out on the road. NSC has gathered research that shows you are 3 times more likely to be in a car crash if you are fatigued. More than 5,000 people died in drowsy driving-related crashes in 2014. Losing even 2 hours of sleep is similar to the effect of having 3 beers. Being awake for more than 20 hours is the equivalent of being legally drunk. Sleep is a vital factor in overall health. Adults need an average of 7 to 9 hours of sleep each night, but 30% report averaging less than 6 hours, according to the National Health Interview Survey. Chronic sleep deprivation causes depression, obesity, cardiovascular disease and other illnesses. Fatigue is estimated to cost employers $136 billion a year in health-related lost productivity. More than 70 million Americans suffer from a sleep disorder. Americans receive little education on the importance of sleep, sleep disorders and the consequences of fatigue, but industry leaders recently have been drawing attention to this issue. Employers, too, are in an ideal position to educate employees on how to avoid fatigue-related safety incidents. NSC supports science-based fatigue risk management systems in the workplace. Fatigue. Approved by the Cancer Net Editorial Board, 08-2018. Cancer or cancer treatment may cause fatigue. This can feel like physical, emotional, and mental exhaustion that goes on for a long time. This type of fatigue is not the same as feeling tired after not getting enough rest. It affects your daily life. It does not match your level of activity. It does not improve with rest. Most people receiving cancer treatment have fatigue. Some may have it for months or years after finishing treatment. How fatigue affects quality of life. For some, cancer-related fatigue only slightly bothers them. Others find that it makes life hard and negatively affects these aspects of life. Mood and emotions. Daily activities. Job performance. Hobbies and other types of recreation. Social relationships. Ability to cope with treatment. Hope for the future. Managing symptoms, which can include fatigue, is an important part of cancer care and treatment. This is called palliative care or supportive care. Talk with your healthcare team about any symptoms you or the person you are caring for experience. Screening and diagnosing fatigue. ASCO advises doctors to screen for and treat fatigue when cancer is first diagnosed. It is an important part of cancer care. In addition, your doctor will ask about your level of fatigue throughout treatment and recovery. Several factors may cause or worsen your fatigue. Before creating a treatment plan, your healthcare team will look at the following. Fatigue history. These questions will help you describe the fatigue to your healthcare team. How severe is it? Rated on scale from no fatigue to most fatigue. When did the fatigue begin? When do you feel most tired? How long does it last? Has it changed over time? What makes it better or worse? Health changes related to cancer. Your doctor may take a blood sample or perform other tests. The results may show cancer-related causes of fatigue. Other health conditions. Health conditions other than cancer may cause or worsen fatigue. Your doctor may ask questions or recommend tests to find them. Treating the causes of fatigue. First, it is important to treat medical conditions that contribute to your fatigue. These include pain. Living with constant pain is often exhausting. What's more, many pain medicines cause drowsiness and fatigue. Ask your healthcare team about other ways to manage pain. And ask about the common side effects of these options. Depression, anxiety, and stress. These conditions can increase exhaustion. Managing stress and treating depression and anxiety often reduces fatigue. Insomnia. Stress, pain, and worry may contribute to insomnia, which means having trouble falling asleep or staying asleep. In addition, some medicines disturb normal sleep patterns. Poor nutrition. A well-balanced diet may help reduce fatigue. Consider talking with a nutrition counselor or registered dietitian. Road. These professionals can help you find ways to eat well, especially when you have taste changes or nausea and vomiting. Anemia. Many people with cancer have anemia, which is when your red blood cell count is low. People with anemia may feel extreme and overwhelming fatigue. Anemia treatment may include nutritional supplements, drugs, or blood transfusions. Treatment side effects. Certain types of treatment can cause fatigue. For example, people commonly experience fatigue at these times: a few days after chemotherapy, a few weeks after starting radiation therapy, after immunotherapy. Coexisting medical conditions. People with cancer, especially those who are older, may have other health conditions. These may include heart problems, reduced lung and kidney function, hormone problems, arthritis, nerve problems.